Hello, and welcome to another Rush Generations Health Education lecture. We are so delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, January 21st. I'm Grisel Rodriguez Morales, Rush Generations Program Director, and I'll be your moderator for today's lecture, What Matters in the New Year? Before I present to you the wonderful speaker joining us today, I'd like to first thank Hannah Weisman for helping with the production of this lecture, as always, helping us manage the chat and other key aspects so that we all can have a great discussion about how to set meaningful goals and identify what matters most to you this year and in years to come. As always, we are live streaming this lecture via our YouTube channel, and we also host a good number of people who join us via phone, and we'll also have an opportunity to listen throughout the program. At the end, when we open it for questions and answers, you'll also have the opportunity to unmute your audio so that you can ask your questions. We are greatly appreciate that you're joining us today. For those of you on YouTube, we ask that you please use the chat function to ask questions and or to add to the discussion throughout the lecture. We will make sure that your comments and your questions make it to today's presenter. We always want to remind you that all information offered here is usually for general informational purposes only, and to always seek additional professional advice for those situations that are quite specific to you and to your needs. Okay? Well, without further ado, let me introduce you to our speaker, Shamir Abbasi. Dr. Shamir Abbasi is a geriatric medicine fellow here at Rush University Medical Center. Originally from Pakistan, he came to the United States to complete his residency. He did that at Dartmouth in New Hampshire, and he plans to focus on geriatric oncology later in his career. How unique. Outside of medicine, Shamir enjoys engaging in the arts and can often be found in a drawing class or exploring a museum. I love that. So thank you so much, Dr. Abbasi, for joining us today. I think the screen is yours at this point.
Yeah, thank you so much for having me. I'm really excited to be here. But yeah, so the presentation topic that we have today is what matters in the new year. The main reason we decided to focus on this topic, and my predecessors also focused on this topic, and I hope to bring my own spin to it, is that healthcare can feel very rushed at times. Your visits with your healthcare providers, with your physicians and doctors are pretty short when you think about it. And most of us are unsure what to ask and what goals for us to set. And a lot of times those goals might not be discussed. And this can be pretty frustrating at times. So this talk is kind of to help provide you guys with those tools and hopefully make sure that the way that we provide care to you and the way that you guys receive care is in line with your values and your goals for yourself. Next slide, please. So the areas that we're going to focus on, the first part is going to be the 4 M's of geriatric care. That's the foundation of my training currently. And that's the foundation of how we approach care for older adults. And then we're going to focus on how to identify goals, how to turn those goals into values. The other 4 M's of geriatric care is how to make sure that the resources, which is your physicians and the healthcare resources that you have, are as effective and efficient for you. And not just focusing on this year, but for years to come, what areas should you guys consider focusing on? Next slide, please. So we're going to talk about the 4 M's initially. The four M's are basically these four categories and divisions on how to approach care for older adults. And this was introduced some time ago. It's been adopted by the American Geriatrics Association. Um, and the idea behind that is when you manage patients with multiple health conditions, it's rarely that there's one treatment that works best. And instead of focusing on each and every single individual problem separately, the purpose of this is to have a holistic and a complete view towards, taking care of patients and providing them with healthcare. And the main goal through this is to make sure that we understand that what is the main priority in your own health for yourself. So the four M's are mobility, mind, medications, and what matters most. So medications is making sure that you have the right medications, making sure that we're not, prescribing you medications that might be doing too much harm. Meditation has to do with not only memory, but also with your mood and your thought process. Mobility kind of focuses on the part of, keeping you mobile, strong, and safe, as well as maintaining your independence, which I think is the most important thing for all patients. And then what matters most is, the crux of all of it is us understanding what your goals, what your values, and what your priorities are for yourself in terms of your health. Next slide, please. So we're going to focus on what matters most. That's going to be the initial part of our deep dive. So what do we mean particularly when we ask the question, what matters most? So there's a way to think about it in terms of, what makes life meaningful to you, what you want your healthcare to support, and what you hope to keep doing, start doing, or avoiding. And these are pretty broad questions for a question that is broad to begin with. And the reason why we ask these is every single patient has lived, or every single person has lived a different life, over the many decades that you've been on this earth. They have different stories, they have different health conditions that have affected their lives, and they have different experiences. And along with that, along with their enriched background, their values are different from each other. I bet a lot of people in this audience right now have different values from each other. Even within the same household, people have different values. So understanding that before we're able to, provide care to you at any point is extremely important. When we ask these questions, and these are just some examples, some patients or some people have different ideas of what things might be that mean the most to them. So it can be staying independent at home or being able to attend family events. Some people want to make sure that they're able to dance at their granddaughter's wedding. Some people say that, I have a lot of symptom burden and I want to manage my pain well enough so that I can just do my daily activities now. I don't have grand goals for what I consider myself to be grand goals. That I just want to garden or travel or, to worship or to go to church. And some people say that they just want to avoid hospitals at all costs. So they want to maintain the independence at all costs. And we can see that these are all things that might be meaningful, and all of these might be meaningful to an individual, or maybe some of these things might be meaningful to an individual, depending on what their values are. And identifying this so that we can give you a more curated, a more personalized approach to healthcare is pretty important at this point. Next slide, please. So one of the ways that you can identify this is through the good day questions. So a good day question would be, what does a good day look like for you? What activities do you enjoy? And what worries you about your health? So these are all like a good day question. What is a good case scenario for you of how you would want to spend the rest of your life. And during this time of self-reflection, where you're doing this introspective exercise and looking into all of these things and imagining what this good day scenario looks like for you. And I hope that all of you are living these good days currently. It is important for your caregivers to also listen to you guys and to listen to the patient and to listen to the person and really hone in. And it doesn't have to be just the one thing that we value. Again, it's that patients and people value many things at the same time and different things at different times as well. So this good day question is not something that is fixed from when you think about it. It is going to change over the many years, like it has changed for you prior to today. Okay, next slide, please. Next slide. Okay. So one of the important things is identifying, these values and turning these values into goals. So how do we identify our goals? Instead of having something as broad as I want to be healthier, it's important to identify within what it means to be healthy for you. Some people say, I want to walk safely. Some people say, you know what, I have my walker, but I want to be able to maneuver with it as far as I can, not have to stop as many times as I can. Some people say, I want to attend family events. Some people say, I want to have less symptom burden. Some people say that I don't want to take so many pills. I don't want to be taking 20 pills in the morning and making that my breakfast. So identifying those goals and those specific goals is important as the initial step. And they don't all need to be medical. You can have a goal for yourself, and it is your physician's job to help, fix those goals and place them into a care plan for you specifically. So the first step that you need to do on your part, as a person and a patient, is just to identify those specific goals. And you have a plethora of resources to help you, hopefully make those goals achievable. Next slide, please. So there are quite a few resources to help you set these goals. There are a lot of online resources. These are just two, worksheets that I pulled off from online. The first one is and for people who are just calling in and don't have a video set up it's from the Patient Priorities Care. So it is a detailed resource that you can use around, I'm going to say 30 pages, and they have pictograms and examples that are pretty easy to go through for, people and their caregivers. And it has different situations and different examples that, hopefully you'd be able to identify yourself within those. When they go through, for example, they had one example of a patient who has, multiple health conditions, like they have diabetes, they have high blood pressure, they have cholesterol, and they, they live on their own and they're fairly independent. What they should consider or how they should approach their goals to be, versus someone who unfortunately is going back and forth to the hospital multiple times during the year. How should they approach this question? So having that resource really helps, I feel like. In this worksheet, as you can see, the first step is to identify what matters most. Next would be to identify health goals for yourself, specific activities that you want to do, realistically, and what's doable. And then you say you want to do XYZ in over this much time frame. For instance, you want to be able to climb stairs again, and your goal is to be able to climb stairs to go in and out of your house. And a line at the bottom of that, it says, if needed, you can revise that health goal for yourself. So as you can see, this is not something that's just permanent at that point. It's a mindset that you have to adjust, over the years. And then it kind of helps you identify what are your most bothersome symptoms, as well as, what current tools you have, what medications you're on, and are those tasks helpful to you? Is this a behavior or a treatment that is beneficial towards you achieving your goals? Or is it being more of a burden and a detriment to you? So this is one worksheet that you can use. I feel like many patients have benefited from this. Another one comes to us from Stanford University. It's a guide for both patients and their physicians when they're approaching this. So it's kind of through the Stanford University's letter project. So you can see the first starting line is, dear Doctor XYZ. So you would be writing, dear Dr. Shamir if you're writing towards me. And, it's literally like you're writing a letter towards your doctors, towards your loved ones, as sort of, last sharing point or an idea of what you think is best for you in this situation. So it asks the same important question, what matters to me the most at this point? And by me, I mean myself as a person, as a patient. And they've given examples like being at home, enjoying time with your friends, doing gardening, traveling, playing with your grandchildren. These are all important goals, and these are all different goals for different people. And then they have a next question which focuses on important future life milestones. So again, if these aren't just, goals that you want right now, some people are like, what, I have these goals about my daily life and I want to be able to attend my granddaughter's wedding, or I want to be able to pick up my grandchild, or I want to be able to buy a home or sell my house and downsize. So these are all different questions. And this itself is a very extensive resource, around 30 pages itself, and it focuses on different areas as well, including healthcare decision making, which we'll touch upon towards the end. Next slide, please. So again, these are the online resources. So the first two are the worksheets I shared with you guys. So the first one is the patient care and partners. So the patient priorities care, that was the first worksheet, which I highly, highly recommend that you go through at least once. If not, yourself, your caregivers, I really encourage you to scroll through that. It's very user-friendly. And the second is the letter project. And that is something that I recommend that, you take with you to your next visit or your next appointment with your doctors and go over that. Try to fill it as much as you can and try to understand it yourself as much as you can. And that is something that I feel like it helps, having a physician or a doctor talk to you through that. Other resources are, what matters to you. This is a instructional video that you can look through. It's an excellent resource. And then for patients who are gender diverse or people who are gender diverse or are queer or on the queer spectrum and are aging, there is a resource for you for friendly aging as well. And this is an extensive resource that you can look through. But yeah, next slide, please. All right, so next are our other M's. Like I mentioned that there were 4 M's who focused on what matters most, but I want to focus on the other ones because they matter as well. First is medications. So unfortunately, a lot of us are on a lot of medications for different health conditions. And, sometimes they were started a long time ago and they may be still relevant, they may not be relevant. Sometimes they are going to be started, but they might have adverse side effects as well. And it's always going to be a risk-benefit discussion between you and your physician. One thing that I want to focus on in terms of medication is that more medicines does not necessarily mean better care. Sometimes, you might go to the doctor and he might give you or she might give you a clean bill of health. And sometimes that might feel like they're not listening to you, or they might not be addressing your problems. But again, it's always going to be a risk-benefit discussion, and the point at the end of the day is to do no harm. And having more medicines may not actually benefit you in the long run, especially because medicines have multiple side effects. And that's one area of focus, particularly that's important to me as a geriatrician. Side effects like they can increase your risk of dizziness, confusion, falls, hip fractures, repeated hospitalizations. So that's one area where, things that matter, medications matter. The next thing is going to be regular reviews of those medications is very important. So again, like I said, certain medications might have been started at one point to address a certain condition, which may or may not still be relevant. Certain medications need to be added to treat other conditions which they might have developed as you age naturally. You might develop some unforeseeable condition during this time period as well. So this is a constant, reflective exercise to see, right now for me, are these medications providing me the best health goal that I want? Next slide, please. So one of the best ways that we do this as geriatricians is the brown bag medication review. So this is basically based on a study that was done in the 90s where they took 200 volunteers to assess a patient's or person's knowledge and the usage of their medicines. So in this review, basically how you do it is, your physician or your provider will ask you to bring your medications in a brown bag and take them to your pharmacist and your doctor to review with you. And basically, the point of this activity is to ensure that people derive the maximum benefit of their medications. So that's going to be, again, making sure that you have your list of medications. The next step would be to identify if there's any interactions between those medications, if those medications are really needed or they're just causing a lot of pill burden, and to, identify any sort of medication-related problem. So this harkens back to the brown bag study that was done, again, like I mentioned, in the 90s. And some important factors that we noted in that study and why it was like, a seminal study for our practice currently is that, 7 out of 10 patients at the time had medication-related issues that needed attention or addressing. 24 were at risk of serious problems or complications, and 70 patients needed changes in their medications or in how they were taking them. So a lot of times we're prescribed medications, but unfortunately, for some reason or another, we don't review on how to take them. A lot of times you will see this with certain medications, for example, like inhalers, where each inhaler is a different way or a different device. So that's something that I really focus on with my patients to go over and review. And this is, again, an activity that I really encourage patients and people to do because one of the goals of this is for you to understand why you're taking a certain medication or why is something being prescribed to you. So that at the end of the day, you understand that is this, again, helping you achieve those health goals that you've set for yourself. Next slide, please. Then are the other two M's, which is mentation and mobility, and why they matter. In terms of mentation, it's not just your memory. One thing is that you should realize that loss of memory, there's certain things that are part of aging, but it's not just aging. So that's one thing that I want you guys to identify and realize, especially as patients and caregivers. And the other thing is that depression is something treatable. It's something that you can achieve to manage, to treat, to control even in older age. So that's extremely important for you to address. The second part is mobility and keeping yourself active and moving every day counts, especially in terms of maintaining your strength and balance to prevent falls. And the core principle at the bottom of all of these is that you want to maintain your independence as long as you can. And I think that's something that I really advocate for my patients at all times, is to help them maintain their independence. Next slide, please. Nice. So the next part is, having your healthcare provider be a resource for you. So just so you understand, what your physicians or your doctors are considering, whenever you go see them, or, when you're speaking to them through my chart or through your messages, is that, one is the treatment that we're providing you helping you or causing you harm. And this goes beyond just, medications, whether we're prescribing you physical therapy, whether we're prescribing you, other sessions or other, non-pharmacological treatments. We always want to be sure that, those resources that we're utilizing are towards the benefit of your health. Are these medications causing side effects? Can you do what matters most to you? Or what we're doing is causing more of a burden to you? And is taking care of someone becoming too burdensome for themselves? So these are all of the questions that, that we consider as physicians. And, it's about better care, not less care. That we really want to consider and hone in, especially when we, approach any sort of patient. Next slide, please. So, that's from the mindset of what we're thinking and from what we want you guys to consider and to ask your doctors when you go see them is, one, what should we focus on for this year? So this is, again, like the theme of today's topic, which is, what matters most in the new year. And asking your doctor yourself that question, in terms of your health, in terms of what's happening, what would they want you to focus on this year? The next question would be, do you still need all of these medications? Do you still need all of these supplements, all of these blood pressure medications, every one of these medications? Is this important for you? The next question would be, what helps you stay independent? Whether it is, getting a more, physical strength and strengthening your muscles, whether it is identifying, your home environment and what might be a detriment to you in that home environment, whether it is, identifying additional resources that can help you maintain that independence. And then the next question would be, for what should you plan for? So again, talking to your doctors about the way they are seeing you at that point in time in terms of your health, what should you plan for within the next, few months? What should you plan for within the next few years? And these are all important questions for you to bring up. And I would really recommend that you write these questions down and you write down answers for yourself as well, and kind of match and talk to your physician about that. And, having yourself bring these questions up or having a caregiver accompany you, whether that is, one of your children or a sibling or a spouse or any loved one or a friend, accompany you during these conversations, who understands your perspective and where you're coming from, is also an added bonus that might be helping you through these situations. Next slide, please. Okay. And now for the part that we need to focus on is what matters in years to come. So I know we focused on initially, what matters in the current year and in the new year, and how should we identify those goals, and how can we focus on, what we value, and then what those values narrow down to those goals, and, using our physicians as resources to manifest those goals. Beyond this year, what I want you guys to think about in years to come are two very important documents that your healthcare provider is going to bring up with you almost every year. And it's part of, our, how we approach healthcare as pediatricians, how we provide care. It's recommended through, the Center of Aging and through Medicare as well. One of the first things is identifying a healthcare power of attorney. My predecessors spoke about this topic in depth, but I just want to touch upon it and bring it up as well. I highly recommend that you go through that video as well. It's very thorough, very useful. So a healthcare power of attorney is basically a person that you designate yourself. And the way I think about this process is, your physicians and your healthcare team want to make sure that the health and the treatment that they provide you and the care that we provide you is in line with your values. And unfortunately, there are times when you cannot communicate those values to them. It might be sometimes, you're brought to the hospital after an unfortunate accident, or you, for whatever reason, cannot communicate, you're too sick to communicate with them. And in those situations where you cannot advocate for yourself, we usually ask you to have a loved one or someone that you trust who can advocate for you. And that person who you trust to advocate for you in your healthcare decisions is your healthcare power of attorney. I just want to emphasize that this is just for your healthcare decisions while you're in a situation where you cannot make decisions for yourself. And at the end of the day, if you're able to make those decisions, then of course we always come to you as the person themselves who has autonomy over their body to make those decisions and advocate for themselves. But this is one person that I truly recommend that you think about who that would be for you, and to select them, when you can, and to let your physicians know who that is. And this is a document that can be formalized. If you do not fill out this document, then at least in the state of Illinois, it goes to next of kin, whether that is, and it goes in a sequence. That would be, I hope I get this right, it's spouse, adult children, siblings, and then, parents. So, a lot of times we're very lucky to have those loved ones in our lives. Sometimes we're not surrounded by those loved ones, and then it becomes really imperative for us to know who you trust to be your advocate. So this is one thing that I really want you guys to focus on in addition to other parts of your care. Next slide, please. Right. And the next part is what we call the post form. So this is basically a very concentrated version of what you can share with us as your healthcare team and your loved ones over how you see your care should be in a situation where you're not able to advocate for yourself. So first of all, this is a guide for your medical team and loved ones on how you would like to be taken care of. It is in line with your goals and, again, what matters most to you. And in this form specifically, and I think a lot of you might have had these discussions with your primary care physician or your geriatrician or some other person in the hospital when you were admitted. And it specifically focuses on life-sustaining therapies, which can be really daunting to decide in the moment. Your doctors might ask you about, would you want CPR? Would you want, to be on machines, and other options in there. Before you focus on what those treatment options are, what's best to focus on is what are your goals in that point in time and for the next foreseeable future in terms of your life and your health. So I would really advise you to focus on that first, okay? And once you've figured that part out, that what things value to you, then you discuss with your doctor that, given that I value these things, and these treatments that are possible, I think that XYZ would be the best decision for me. So certain people might say, you know what, I'm extremely healthy, I live a healthy life, I want to receive all kinds of treatments no matter what. And some people say that, you know what, I've lived a healthy life, I love my independence. And if I have to go through these treatments, I might be losing that independence, and that does not sit right with me. I don't want to be a burden. So I would like to withhold from these specific treatments. If it ever comes down to it, if I ever become extremely sick. At the crux of it, again, is the topic that we've been focusing on today, that what are your goals and what matters most to you. one thing that I would recommend is that you have these discussions when you're having one of your good days. So again, like any other day, I want you to take some time, or during a doctor's visit, your wellness visit, take some time and think about these things, and have these discussions when you're in your best mood and your best state of mind, um, because this is a very important decision that you can make. And making these decisions and sharing these decisions with your loved ones, is one of the most loving things that you can do, by letting them know that in a situation, in that dire situation where you can't make a decision for yourself, you know, you already have a plan for them, and you can take that burden away from them of having to choose in that situation. So this is the other thing that I really recommend, that talk to your doctors and ask them, is it possible for me to fill this out at this point in this venture? But yeah, next slide, please. But yeah, and I think this is our final slide. So again, I just want to focus on that your goals matter. I want you to share them with your loved ones. I want you to share them with your physicians, with your healthcare provider. I want you to understand that they are going to be changing over the years, and I want you to revisit them from time to time. And I want you to understand that the healthcare that we provide should support your life and should not be a burden to your life. But yeah, I think that's pretty much it.
Thank you so much, Dr. Abasi. This is that we have. And just so you know, we were asking our YouTube part, or some of the things that matters to them. What are the goals for this year? And
Oh, nice.
I wanted to touch a little bit on the goal setting tools.
Nice. So especially going over the form where, tell us what matters most to you, which was by Stanford University, and you're writing a letter to your physicians and to your loved ones as well. I think that's just a good way of framing that question and that exercise. Sometimes it's not easy for us to verbalize those things. Sometimes people think it's easier to write it down. Um, maybe if saying it out loud might be a bit more difficult, it might make things seem a bit scarier, a bit more permanent. So being able to write those things down seems more personal, and it might be a kind of like a baby step towards having those discussions with your doctor or with your loved ones as well. So I think these written resources are really useful. There are also videos on these websites as well for you to go over and go through. I know it's not always fun reading over screens and going through that material over and over again. So I think those videos are also pretty concise. They're like 5 minutes or 6 minutes. But these are great resources. I'm going to plug in Josh Generations as well, and their website, which is an excellent resource as well.
Thank you. That's great.
Yeah. But yeah, no, I think especially being in age-friendly healthcare setup, it's extremely important, and being able to work in this environment and recognize that we put value through these things has been extremely important for myself as a provider as well.
Absolutely, absolutely. So my question was to see, I was curious about how open are people to talk about end of life? Because I found that at times to be challenging.
Oh, I think that is a very difficult topic, especially in your clinic settings where you are limited by time, and it's not a topic that we discuss in just one setting. Again, because it's such a huge discussion, so we usually piecemeal it, and we usually talk to our patients. Again, the most important thing isn't what treatments are you going to go through. The most important thing is, what do you value for yourself? And that, I feel like, is the best way to approach this, is understanding, in this current situation, the way you feel, the things that you want for yourself, that you want for your family. What do you value for yourself? And if things change, do you think those values are going to stay the same, or do you think those are going to change? And given the way that, the current treatment that we're providing, is that reflective of that care? And, if that treatment that we're providing, turns up the ante and, we have to do more interventions, does that still stay in line with what you value? So I feel like these questions, even though they might be sometimes very bluntly asked, like, oh, have you ever thought about being on a ventilator? I mean, that is such a brisk question, quite a forceful question, which is not something that we imagine. I mean, I hope nobody is imagining that for themselves in their daily life. But truly, these questions are very difficult. I think I will say they're as difficult for us to ask as it is for someone to think about it. But honestly, it's one of the most important things that you can do for yourself, for an advocate for your own health, and having your own health in your own control. And this just makes sure that, in an end-of-life situation at the possible end, you still have that control, that autonomy over your body. And honestly, making that decision, like I said, is one of the kindest things that you can do. Letting your loved ones know that, you know what, I've thought about this. I don't want you to go through this, awful decision for me. I'm being brave right now. I've decided that this is what I value right now. If things were to change, this is what I might have considered. But, having that dynamic discussion is really important. It's difficult.
It's important to mention that it is. It's difficult to have difficult conversations.
Yeah.
But it is important that, yes, you can always do it in small dosage. I said, just always manage how much you and the person in front of you can manage. But since it is that important to you, continue then finding ways to address your wishes, to address your concerns, to address your questions and things like that. The same goes with power of attorney for healthcare, for people to understand this is in the event that at some point you cannot make a decision, but you will continue. A lot of people think that they're going to be losing their autonomy immediately because they complete a form. So it's good to get clarification and especially to see how much you can do in different sessions until you finally get your wishes expressed. The same goes with POLS, the Practitioner Orders for Life-Sustaining Treatment. That's what POLS stands for. And just to clarify, those are for patients that are like they're dealing with a life-threatening medical condition, right? Those are closer to probably needing to express their concerns. So the good thing is that we have providers that are trained and have seen this with families from diverse backgrounds. So because that's an important concept as well in terms of cultural values, you have to manage that as well. How do you bring that up in a way that doesn't take away what people culturally feel, what can be talked about, what cannot be, all of those things. So thank you for those resources. Maybe what we can do is also including them later in the description of the lecture, so that way people have them at hand and can reference them before. I'm so glad that you mentioned also the brown bags. We have done those at Rush Generations as well, and actually, we have done it with either brown bags themselves or plastic bags, but nevertheless, it's so key, especially for family caregivers or for a family member that is trying to support someone that handles multiple medications, to have an opportunity to see if everything that they have in front of them is what the person should be taking. The amount of times that we in the clinic have seen people that is the same medication but prescribed by two different providers. So you have to decide, actually, it can be only one of this. So though that medication reconciliation is important. How often do you see people coming to the clinic actually with a brown bag or Ziploc bag or whatever?
It's honestly one of the better days when they do that because it's so helpful for us. I think in our geriatrics clinic, we've just made it such like a precedence that this is something that patients should be doing, and if they're able to bring it, that's great. So I would say that like at least half of my patients will do that, especially if they're like a new patient.
Nice.
Like I think our whenever we schedule appointments or anything like that, they've been really receptive to it. So they'll bring the bottles or they'll at least bring the pill box as well. So that's been extremely helpful. And it kind of helps you understand as well. And when you talk to patients, when they look at the bottle and they say, I take this medication and they have it in line. But then when they look at it, it's like, oh, wait, no, I've been taking this, I think, twice a day. I think I've been taking it twice a day. So, and it's honestly, it is difficult, especially when, unfortunately, when, your doctors are, we're going to be changing those medications as frequently as we normally do, without understanding what burden or effect that it has. So this is kind of like an exercise for your security, for your safety, and also to help your physicians recognize that, these are a lot of medications, these are very burdensome. It's just the best thing for me right now. So yeah, but I think the patients that come to Rush, I've been extremely lucky. It's sometimes it's a luxury.
Yes. Well, great. That's what we're here from. What we're here for. So, I think that's it on our end. We greatly appreciate you joining us and giving us more information about how we can start this new year. And I love it's not only this year, it's all the years to come.
Yeah.
Hopefully this information will help all of you, not only throughout the year, but maybe for the next 2, 3, 4, 5 decades to come. So thank you for joining us. And now we would like to give you a little bit more information of resources and programs that we're going to be bringing so that we can support you in the goals that you have, in particular if it's about your health, physical health and mental health, your emotional well-being. We are all for that. We are here for all of that. So the first workshop that we're going to be offering or that we want to tell you about is a matter of balance. This is a falls prevention program. We know that falls are a big issue, a big concern. So this is an 8-session workshop for individuals who have begun restricting their physical activities or their social activities because of a fear of falling, which usually happens after you fall once or more than once, then you may develop a fear of falling. The workshop utilizes problem solving, confidence building, balance improving exercises, and also cognitive restructuring to help you prevent falls, to help you improve your balance, to regain your ability to do what is most important to you, what matters most to you. The next workshop is going to be in person on our main campus, Rush University Medical Center. It's going to be on Tuesdays and Thursdays, starting on February 3rd, and it goes through February 26th. So it's 4 weeks, 8 sessions from 10 a.m. to noon. If you're interested in this program, please call us at 1-800-757-0202. Then we are offering Learning to Live Well with Chronic Pain. is a 6-week workshop for people living with chronic pain. And participants in this workshop engage in discussions and skill building activities to better cope with the day-to-day management of chronic pain. All the sessions incorporate an exercise element and strategies for medication management, for pacing activities and rest, etc. The next workshop will be held virtually via Zoom on Thursday, starting February 19th to April 2nd from 1 p.m. to 3:30 p.m. So it's a 2.5-hour session 6 times. And if you have never done Zoom, don't hesitate to still give us a call, because we can also help you figure out how to manage that virtual platform. We created early in the pandemic, about 6 years, almost 6 years ago actually, a manual that helps you manage Zoom and virtual programming. And for that, feel free to, again, call our toll-free number, 1-800-757-0202. As always, we want to learn from you. Shaman Senior Voices aims to empower older adults and to discuss what matters most to them as they age. It is important to share what matters most to you with your physician and your loved ones. So Shaman Senior Voices wants to hear from you. We want you to consider sharing your wisdom on why it is important for your healthcare team and your loved ones to know your goals and your wishes and what matters most to you. And you can record a video that and get a copy for you that you can share with them later. So feel free to scan that QR code to record on a mobile device or smartphone. And again, if you have any questions about this or any of our programs, you know where to find us. That 1-800, what toll-free number is available to you at all times. Okay, the next lecture is going to be on preparing. It's called Preparing for the Fourth Age. There's a beautiful article and interview that is in the last newsletter that we hope you should receive in the mail. If not, again, feel free to give us a call. But we hope to see you next week, next Wednesday, January 28th, again, starting at 1 p.m. So don't forget, next week. And again, for any questions, don't hesitate giving us a call, 1-800-757-0202. For now, until next week.